Now I ask that the four organizations and those leading the organizations come to the microphone for 5 minutes of comments to the committee members. Dr. Susan Reinhart, Senior Vice President Director, AARP Public Policy Institute, and Chief Strategist, Center to Champion Nursing in America. Thanks, Susan.
Thank you, and thank you for the opportunity to speak on behalf of AARP and the Center to Champion Nursing in America, which is an initiative of AARP, the AARP Foundation, and the Robert Wood Johnson Foundation. Last month, you heard from our volunteer president, Dr. Catherine Alicia Georges, who has just been named as a living legend in nursing, so we're pretty excited about that. And she shared our organization's perspective on the importance of nurses in caring for older people and their families. And as she said, AARP is committed, fully committed, to maximizing the capacity of nurses for this job to meet the healthcare needs of older adults. And we need to do more to ensure nurses are prepared for those responsibilities to care for an older population and empowered to do that job and to address the social determinants of health. We have to make sure nurses are prepared in geriatrics and population health, supporting family caregivers, taking on leadership roles in the community, and able to identify and help people who are affected by social isolation, by food insecurity, transportation and housing concerns, and other social determinants. AARP is completely committed to promoting the health and well-being of our members and to addressing the social determinants of health across the entire AARP enterprise at both the national and state levels. We work on this issue on many fronts. I mentioned supporting family caregivers, addressing social isolation, big issue for us, high prescription drug costs, initiatives that promote livable communities for all ages, and more. The Future of Nursing Campaign for Action, which you heard me speak about in March, also works on many of these issues. So I'm trying to represent myself in a couple of different lenses as a nurse and a former state policymaker, leader of the AARP Public Policy Institute, and that of the chief strategist at the Center to Champion Nursing, where I co-lead the campaign with Dr. Susan Hassmiller. And I'd like to share some lessons that I've learned from all of those different lenses, and I hope that the committee could consider the success of the first Future of Nursing report and accelerate progress by some of these strategies that we have found to be proven successful. First, when driving change, it's essential to engage people and groups at the local, state, and national levels. At AARP, of course, we do this at our national office and all of our state offices. At the campaign, we do this through our national campaign office, but also our action coalitions across the state. And it's worth noting that many of our action coalitions have taken that to a regional level to get even more local. Second, it's critical to set national goals and to chart and measure progress. We did this by creating a national members, a dashboard, to track the efforts to implement the first Future of Nursing report, and we update that twice a year. We've also encouraged states to develop their own data so that they can see what's going on, again, at the state and local level, so that we can see progress. And just as one example, we've seen how we met and exceeded the first report's recommendation to double the number of nurses with doctorates. Third, it's important to engage diverse stakeholders. I cannot say this enough, diverse stakeholders in support of your work. The campaign's work to modernize advanced practice, scope of practice laws has been successful in part because we have engaged, of course, the nursing organizations who have worked for years on this, but many diverse stakeholders, including our state offices, but also business groups, other advocacy organizations, insurers, consumers, and policymakers from both sides of the aisles. Fourth, when creating large-scale change, showcasing and highlighting promising practices, trends, and exemplars can help stakeholders learn from each other's work. We call that, of course, just, stealing shamelessly, as we all should do. And we've done this through regular and ongoing convenings, getting people together, either face-to-face or certainly remotely, all of the 51 state action coalitions, allowing them to learn, share, and scale successful strategies across the country. And last but not least is friendly competition that can spark and drive change. At the campaign, we've done this through national grants and awards where states can step up and compete, but we've also done this at AARP through through community challenge grants with very little money that can go a long way. So I hope you'll think about this and adopt some of these strategies. And I also want to reinforce AARP's commitment to this work, the future of the nursing profession, to nurses as vehicles for addressing social determinants. And I can tell you with 38 million members, the largest membership organization of the world, that we will stay committed to this. You can count on us for people of all ages. Thank you.
Now we invite Karen Cox, who is the president of the American Academy of Nursing.